الله الرحمن الرحيم. أستاذ مساعد دكتور أحمد صلاح حميد من كلية طب الاسنان قسم جراحة الفم. أقدم المحاضرة والتي عنوانها Acute alveolar osteitis, or what we call the dry socket, or sometimes it is also called fibrinolytic alveolitis. Acute alveolar osteitis, or also as I mentioned, it is also called dry socket. It can be defined as a complication of tooth extraction in which the tooth or the blood clot disintegrates, exposing necrotic and infected socket wall. So this is actually, it is the complication of tooth extraction. It is usually called acute alveolar osteitis, or sometimes dry socket, or also it could be termed fibrinolytic alveolitis. So it is complication in which the blood clot is very important during healing of the tooth socket after tooth extraction. So sometimes, for certain reason, the blood clot disintegrates, exposing the necrotic. This is necrotic and infected socket wall. This is the bone, so exposed. So this is caused severe pain. It is usually occur more in the mandible than the maxilla, and actually this is related to blood supply of the mandible. Since the blood supply of the mandible is less than that of the maxilla, so it's most commonly occurs in the mandible than the maxilla. And usually it occurs after extraction of lower wisdom tooth, particularly the impacted teeth or deeply buried tooth. So this is actually since this needs more bone removal, so more surgical trauma, so this will lead to the development of dry socket or acute alveolar osteitis. And also it is more occurred in the female than male, and this is actually related to hormonal differences between the male and female. Usually after tooth extraction here, the blood clot will be formed. This will fill the tooth socket. But for certain reason, for example due to infection or due to trauma, the blood clot, which is composed of fibrin and also the platelets, this will be disintegrates and exposing the bone, and this will lead to the infection or necrosis of the bone, and this will lead to the development of dry socket. Here, the pathogenesis actually of dry socket during tooth extraction, if we use excessive force during tooth extraction, or we use elevator or dental chisel, in this case excessive force, this will lead to actually release of inflammatory mediators from the bone. There is a release of tissue activators or any mediators of inflammatory mediators, and this will lead to the formation of plasminogen. Plasminogen will be converted to plasmine, and the plasmine causes lysis of the blood clot and also formation of kinin, which lead to, or this explains why the dry socket usually present clinically with severe pain, because there is formation of kinin and also the lysine or lysis of the fibrin of the blood clot by fibrin. So since there is trauma or excessive force, this will lead to inflammation, formation or releasing of the inflammatory mediators, and release of the tissue activators. This activate the plasminogen, which will convert to plasmine, and this will lyse the fibrin threads of the blood clot, and this will lead to disintegration of the blood clot and formation of kinin, so exposing the socket wall, and this will lead to necrosis, infection and necrosis of the socket wall. The etiology could be related to trauma or infection. For example, in case of physical dislodgement of blood clot, this could be related to patient, so the patient maybe use mouthwash or heavy rinsing of the mouth, so this will lead to dislodgement of the blood clot. That means this is related to mechanical force. The mechanical force causes displacement of the blood clot, and this will lead also to exposing of the socket wall and development of the dry socket. Sometimes infection, this infection also due to release of certain factors from the pathogenic bacteria or any microorganisms, and this will lead also to lysis of the fibrin threads of the blood clot and also exposing the socket wall infection and necrosis and development of dry socket. Particularly in case of the if the tooth is previously infected with periapical infection or even with periodontal infection. Also, this may lead to, because there is bacteria, so there is infection, and this is one of the possible causes of the dry socket. Traumatic extraction, as I mentioned before, due to heavy force, releasing of inflammatory mediators, activation or release of tissue activators, and this will lead to the formation of plasminogen, release converted to plasmin, and this is lysis the fibrin of the blood clot. So excessive force should be avoided, or excessive trauma or excessive force during tooth extraction should be avoided. So we can use, for example, sectioning of the tooth or any simple extraction in order to avoid trauma and excessive force. Local blood perfusion and anesthesia. As we mentioned before, that dry socket or acute alveolar osteitis usually occurs after extraction of lower wisdom tooth. This is, some people said that this area, I mean the area of the lower wisdom tooth, usually there is less blood supply. So that means less local blood perfusion. So this is one of the causes of the development of dry socket, because there is a highly possibility that the blood clot will not be formed. But this is actually, it is not, it is just suggestion, it is not approved. And also because of the anesthesia, because some people said that use of vasoconstrictor, this vasoconstrictor will decrease the blood supply to the area, and this is one of the possible causes of the development of dry socket. So both of them, if we can see, either related to anesthesia, that means the vasoconstrictor and the anesthesia maybe decreases the blood supply to the area, and this will lead to the development, not formation of blood clot, and this will lead to the development of dry socket, or could be suggestion that the retromolar area or the area of the lower wisdom tooth decrease the blood perfusion, and also this is one of the explanation for the development of dry socket in the area of the lower wisdom tooth. Excessive irrigation and curettage of the alveolar socket after extraction. Actually, excessive irrigation, this will lead also to mechanical dislodgement of the blood clot. And also curettage may lead, if there is infection, particularly in case of the periapical infection, curettage may lead to this spread of the infection. And this will lead to also one of the causes of development or establishment of the dry socket. Smoking, this has two components. The first component is the presence of nicotine, which could be which could act as a vasoconstrictor and decrease the blood supply to the area, or could be due to mechanical, because there is negative pressure, so dislodgement of the blood clot, and also both of these components may lead to the development of dry socket. Oral contraceptive pills, actually the presence of estrogen also may be attributed to the development of or establishment of dry socket, because this is also may lead to the research showed that estrogen may also contribute to the development of dry socket. This is by increasing certain hormones, and these hormones may cause lysis of the fibrin of the blood clot, and this will lead to development of dry socket. For this reason, actually, since there is estrogen, so actually this is this explains why the dry socket more occur in case of female more than male, because actually differences in the hormones and the presence of estrogen. Roots or bone fragments, actually this is, the roots may induce the formation, or bone fragments may induce the formation or the development or establishment of the dry socket, but actually it is to a lesser extent. Poor oral hygiene, actually sometimes, as I mentioned before, the plaque or sometimes the bacterial biofilm may be one of the causes for establishment of the dry socket. So as we can see, that the main etiology of dry socket either related to blood supply, decrease ischemia or decrease in the blood supply, or could be related to infection or trauma. The clinical features of dry socket, as we can see here, usually there is dull or severe pain. Actually, usually the patients attends to dental clinic after 2 to 4 days. The development usually after 2 to 4 days of tooth extraction. Pain may radiate, since there is severe pain, so the pain may radiate to the ear or temporal region. Swollen, we can see there is swollen, and red gingival margin, because there is inflammation. As I mentioned before, in case of excessive force during tooth extraction, this may lead to releasing of inflammatory mediators, so this leads to swollen and redness of the gingival margin. Bad odor or taste, because the food impacted inside the tooth socket, and this will lead to fermentation and give, or due to disintegration of the blood clot, also give bad taste or bad odor. Socket devoid of blood clot, as we can see here, that the socket, there is no blood clot because the blood clot already disintegrates. Bone is bare and sensitive to touch because there is release of inflammatory mediators, canine or other factors, so there is severe pain and it is sensitive to touch. Food debris trapped in the socket, as I mentioned before, and also there is lymphadenopathy. Actually, this is an inflammatory process of the bone, but sometimes might be associated with infection. As I mentioned before, one of the causes of dry socket is infection. So, for this reason, lymphadenopathy, submandibular lymph node, or palpable submandibular lymph node could be present because sometimes there is infection associated within the, or could be the cause of dry socket. For this reason, we can also see there is lymphadenopathy. Now, how we can manage this inflammatory condition? So this is an inflammatory condition, but could be the infection, could be one of the causes of dry socket. The treatment could be by use irrigation with warm saline, because actually, first of all, the patient should be given local anesthesia, especially or particularly in case of lower teeth. So after local anesthesia, we can do irrigation with warm saline. This is to remove the food debris, any fragments of the blood clots, food impacted, food impaction, anything could be removed by the irrigation. Actually, some people nowadays suggest use curettage in order to induce rebleeding. Actually, rebleeding could be induced by irrigation. The reason or the aim or the goal behind irrigation with warm saline, not just to remove food debris or fragmentation of the bone or blood clot, but also to induce rebleeding. We need bleeding in order for the reformation of the blood clot. Medicated dressing could be used as a sympathetic dressing. This sympathetic dressing may contain, for example, alveolar. Alveolar, which is most commonly used, this is as fibers. Nowadays, most commonly used are actually alveolar. This is containing anesthetic, analgesic to relieve pain, anesthetic as well, and also it could also contain antimicrobial agents. So alveolar, it is one of the medical dressing used nowadays in order to manage dry socket because it contains anesthetic, analgesics, and antimicrobial agents. Actually, in the past, people used zinc oxide, but it is not advisable to be used nowadays because it retards the healing process. Non-steroidal anti-inflammatory drugs, analgesic, could be used also in order to relieve pain, paracetamol or Polistan or any one of these. Metronidazole, 400 milligrams 3 times daily for 5 days. Actually, this is because, as I mentioned before, it is one of the etiology of dry socket could be infection. So most commonly actually related to anaerobic bacteria. So for this reason, metronidazole could be given actually in order to treat the infection associated with the inflammatory process. More recently, people using photodynamic therapy, laser therapy, could be also used in order to treat dry socket, and also plasma-rich fibrin. Actually, also this is because it is capable of inducing bone formation as well as in the healing process. So This is the end of the lecture, and thank you for your attention.